of you. Myself Shubham Kuneda, faculty of MLT department from School of Medical and Allied Sciences of Galgotias University, dealing with the course BMLS3002, and the name of the course is Basics of Hematology and Hematological Diseases. So first of all, the introduction of the topic is we are going to introduction of hematology. We are dealing with the introduction of hematology. So what is the prerequisite and recapitulations? Means what is hematology stands for? Hematology is a branch of medicine that focuses on the study, diagnosis, treatment, and prevention of diseases that can cause abnormalities in the blood. Means hemat, simple means hemat means blood, and logy means study. So study of blood. It is a branch of medicine that focuses on the study, diagnosis, treatment, and prevention of diseases. Means all those diseases which cause abnormalities that are responsible to cause any problems related to blood. That is known as it is a branch that deals with this, and this branch is known as hematology. Now we are going to discuss about the objectives. What are the objectives of this unit that we are discussing about? So in this, first of all, we need to study about the definition of the hematology. What is the role of hematology in the identification of the diseases, and what are the different components of the blood? Means the cellular components, plasma, and all these things we are going to study about. And we are going to study about the normal ranges. Means what is the exact criteria that till which normal range will this specific cellular component have a normal value. We can consider it as having a normal value, and till which range we are saying that these values are abnormal. Now, having a brief study about this introduction of hematology. Hematology is a branch of medicine that focuses on the study, diagnosis, treatment, and prevention of diseases that can cause abnormalities in the blood. As we have discussed before also, hematology, I told you that hematology means, hemat means blood and logy means study. So study of blood. It is a branch of medicine which mainly focuses on the study of the blood cells. The diagnosis means the abnormalities due to the different composition of blood. What is the treatment, how we can treat those abnormalities? What are the prevention of their diseases? Means if we are having any disease likewise anemia, so what is the prevention of the diseases, and what are the causes? Means what allows them to cause abnormalities in the blood, and the various components of the blood cells. Likewise, we know in our blood cells there are different things. There are blood proteins, there is hemoglobin, platelets, blood vessels, we can say granulocytes, WBCs, platelets, and multiple things. So discussing about these things and all those organs which are responsible for production of blood. Means actually blood comprises of three things, we all know. That is, first of all would be your serum and plasma. Second is your the components like WBC and platelets, and at the top is your this RBC. So these components they are prepared. Where are they majorly prepared? They are majorly prepared in the bone marrow and the spleen in the trimesters. Means when the baby is about to born, when the baby is in the placenta, during those three trimesters are there. So during every trimester, the formation of these red blood cells, white blood cells, they are in different parts. So bone marrow, spleen, they are responsible for the formation of the blood. Now it has mentioned that doctors who specialize in this branch of medicine, means doctors who are specialists in this branch, who are dealing with the branch of medicine, they are called as hematologists. Now we have already discussed about the parameters, the ranges. Means what are the different ranges of the different parameters in the blood. So here we are discussed with these, we are described with these. Now moving on forward, the first parameter is HB, that is hemoglobin. Hemoglobin, it usually refers to heme and globin. Heme and globin means iron and protein. Heme means iron and globin means protein. So this hemoglobin, it is responsible for carrying of oxygen in the blood. Now discussing about the parameter that is hemoglobin. So the actual range of hemoglobin in gram per liter is 115 to 165 in females and 130 to 180 in males. Moving on forward to the count of red blood cells. The count of red blood cells is 10 raised to the power 12 per liter. Means actually in per cubic mm of blood we are calculating it as 4.5 to 5.5 million per cubic mm of blood. That is mentioned over here 4.50 to 6.50. Now there are different parameters. Likewise, if we are going through, that is HCT, hematocrit, MCV, mean corpuscular volume, MCH mean corpuscular hematocrit, MCHC mean corpuscular hematocrit concentration, WBC, WBCs, platelets, neutrophils, that is monocytes, eosinophils, basophils, ESR. What is ESR? That is erythrocyte sedimentation rate. So these are the different factors how we are moving on through, means what are the factors that we are calculating. The MCH, likewise it is the size and color of the RBCs. MCHC, it is the specific origin and cause of these RBCs. Now moving on forward, WBC, platelets. You know platelets, what are they responsible for? Platelets in the body, they are responsible for the clotting of the blood. WBCs, they are responsible to make our immune system strong, means they will be fighting against the foreign particles that are infecting our body. So now these WBCs, they are again divided into major two types. That is, one is your granulocytes and other one is your agranulocytes. Moving forward, these granulocytes means all those blood cells which are having granules present inside them, they are called as granulocytes. These granulocytes, they are further divided into three types, that is lymphocytes, monocytes, and now here we are going to discuss about the branches of hematology. Means branches of hematology which deals with these bleeding disorders, will deal all those criteria that are related to the blood. Okay, in this we are generally having, there are generally three types. So first one that deals with the bleeding disorders. The second one is the basic hematology, and third one it is the transfusion medicine and hematology. Means in this, first of all we are dealing about the bleeding disorders. Means what are the different types, like a person who is unable to have all those criteria for which there are problems in the blood. Likewise, if there is a cut in the body, okay, and the blood is unable to clot, so it is considered under as a bleeding disorder. So in this condition, we would be dealing with the bleeding time, clotting time. There are multiple things. Basic hematology, all those means all those things which are dealing with the cellular components, means the specific size, color of all the cellular components of blood, moving from RBC, WBC, platelets, and your all these things, granulocytes, agranulocytes. If there are certain changes, if the actual size, shape, it gets changed, so it will be under basic hematology. Now transfusion medicine and immunohematology, it is a very different branch. It deals with like the cellular components. If a person is going to donate blood to the other individual, so in that case he is going to donate the blood. Now we are going to do cross matches, and these cross matches, they are usually performed in the blood banks, transfusion medicine labs. In this we are checking about the compatibility, that whether the blood is compatible, whether the person who is receiving the blood, is he, we can say the recipient, is his body's immune system or his body's blood compatible with the one that he is taking from. Means the donor who is giving, he should have, he should not follow any criteria, but the person who is taking the blood, who is the recipient, he should be means compatible with the blood that is going to be inserted inside him. Now, as discussed in the previous slide about the bleeding disorders, here it is mentioned what does the bleeding disorder include. Bleeding disorders include hemostasis, mechanism of coagulation of the blood, collection and anticoagulants used in coagulation studies, the platelet count, the platelet function test, the bleeding time, clotting time, and some of the other coagulation studies is PT, means bleeding time, clotting time, prothrombin time, APTT, and TT, etc. So APTT, activated partial thromboplastin time, these are the different things. So and uh, means specific values, we need to know about the specific values, what are the actual values for this, and by knowing the actual values we can give the criteria that whether these are normal in range or they are abnormal in range. Now, transfusion medicine and immunohematology. So, what does this include? It includes the blood collection and preservation of the blood, the demonstration of different types of blood grouping, that is ABO blood grouping, the demonstration of RH typing, means the rhesus factor typing, Coombs test, as already discussed by me. I told you Coombs test, the blood is whether compatible for the individual to receive the blood or not, and demonstration of cross matching, which includes major cross match, minor cross match, and demonstration of investigation of transfusion reactions, which are considered under this transfusion medicine and hematology department. Now the last but not the least is the basic hematology. So what does this basic hematology includes? It includes the total red blood cell count and the total white blood cell count. Means exactly there are normal ranges for them. So when a person goes with an calamity or any problem, any disorder related to blood, what will be the alterations, what will be the changes in the total count of the blood. So in this reticulocytes count, it consists of hemoglobin estimation, it consists of ESR, that is your erythrocyte sedimentation rate, it consists of PCV, PCV means packed cell volume, it consists of blood indices, and on these blood indices we are discussing with MCV, mean corpuscular volume. The normal range is 80 to 96 micrometer cube, and the formula is PCB per liter of blood divided by RBCs in millions per cubic mm. Next one is MCH. MCH is mean corpuscular hemoglobin. That is, the formula is hemoglobin in per liter of blood divided by RBCs per million cubic mm of blood. Same with go with MCHC, mean corpuscular hemoglobin concentration. The formula is hemoglobin in deciliters of blood. Like, see the difference in MCH, mean corpuscular volume, mean corpuscular hemoglobin. The formula was hemoglobin in per liter of blood. Now in mean corpuscular hemoglobin concentration, the formula is hemoglobin in per deciliter of blood multiplied by 100 divided by packed cell of volume in deciliters. And last one is the color index. Color index is the percentage of HB, means we are usually taking it as 14.8 gram as 100% divided by RBC's percentage, and the RBC's percentage is 4.5 to 6.5 we are taking. So here in this formula we are taking 5 millions per cubic mm as 100%. So these were the references which were taken by me to prepare these slides. They were different things we uh, taught to the individuals, and there are different things we use to make the slides, because the language is different for all the students. So these are the things. Likewise, different notes preparation we have done from the different references. So thank you all. This was all for this first unit, first topic, introduction of hematology from my side. Thank you.